Welcome once again. I am Dr. Maddie, a consultant gynecologist, a respected men's health specialist with over 30 years of clinical experience. How to stop peeing when you have an erection? This is a question I get asked every day when you're urinating. Muscles called sphincters located at the base of your bladder and urethra relax, allowing urine to flow. However, when you become aroused, signals from the brain trigger the release of hormones like testosterone and nitric oxide, which increase blood flow to the penis, causing an erection. This surge of blood to the penis creates pressure, pushing the bladder downwards and compressing the urethra. The disease primarily affects men over 40 and can cause discomfort, pain, or difficulty during erections and sexual intercourse. While the exact cause remains uncertain, factors like inflammation, autoimmune disorders, and blood vessel issues are believed to contribute to the development of Peyronie's disease. During an erection, the penis becomes firm and larger due to increased blood flow caused by the release of nitric oxide and other chemicals. It is important to emphasize that there is a wide spectrum of what is considered normal when it comes to ejaculation times. This technique is used to delay ejaculation and involves consciously stopping and starting your arousal. Penile girth refers to the width or circumference of the penis at its widest point. Like penile length, girth can vary significantly among men, and there's a wide range of what's considered normal. On average, the average length of a flaccid penis is around 5 inches, and during an erection, it's around 6 inches. Regarding girth, the average is around 4 inches for a flaccid penis and 5 inches for an erect one. However, it's essential to recognize that these are just averages and variations in size are completely normal. Another method is the squeeze method, which focuses on compressing the penis during the arousal phase to reduce blood flow and delay ejaculation. These methods are easy to learn and practice, offering a sense of control and confidence in managing your sexual experiences. But if these techniques don't work for you, don't hesitate to reach out to a urologist or sex therapist for additional guidance and support. What might be premature for one person could be within the range of normality for another. However, if you personally are concerned about ejaculating sooner than you like and it is causing distress or impacting your relationship, it's worth considering some strategies that can help extend the time it takes for you to ejaculate. The muscle of the penis relaxes, allowing blood to fill the spongy tissue called the corpus cavernosum. This engorged tissue compresses the veins on the outside of the penis, trapping blood and maintaining the erection. The frenulum is a small fold of skin under the penis that can become enlarged and tendered during an erection, while some individuals may be concerned about their penile girth. It's important to remember that satisfaction in sexual relationships doesn't solely depend on girth. Communication, mutual respect, and a strong connection between partners play vital roles in creating fulfilling sexual experiences. If you have concerns or insecurities about your penile girth, consider consulting a urologist or sex therapist who can provide professional guidance and support. They can address any underlying medical conditions, provide information on average sizes, and offer reassurance based on your individual circumstances. It is important to note that an erection typically lasts only a few minutes to half an hour depending on the individual. If an erection persists beyond 4 hours or causes pain, it's crucial to seek medical attention as it could be a sign of priapism, a condition requiring prompt treatment. Overall, understanding the mechanics of erections can help individuals appreciate the complexity of sexual function and prioritize sexual health. As a result, the urethral sphincter relaxes, allowing urine to continue flowing. Treatment options may include oral medications, vacuum erection devices, or penile implants, in addition to addressing the physical aspects of the disease. It's essential to consider the psychological impact on the individual. Sex therapy or counseling can help couples cope with the emotional and relational challenges posed by Peyronie's disease. Managing Peyronie's disease requires a multidisciplinary approach involving urologists, sex therapists, and other healthcare professionals to provide comprehensive care and support to those affected by this condition. This is why it can be challenging to urinate during an erection. But why do men face challenges stopping urination during an erection? And how can they effectively stop peeing while having an erection? Let's delve into these issues. But before we continue, please like this video and subscribe for future updates. It helps us grow. So the process of stopping peeing when you have an erection involves a complex interplay of the nervous system, hormone regulation, and muscle control to stop peeing while you're having an erection. You need to manage your arousal and focus on your bladder control. One effective approach is to squeeze the muscles around your urethra and anus, gradually reducing the flow of urine. It's important to consult a healthcare professional to identify and address the underlying causes. Remember that managing erectile dysfunction requires a holistic approach involving both physical and mental health considerations. With the right support and interventions, many individuals experiencing erectile dysfunction can improve their sexual function and overall well-being. You can also contract the abdominal muscles to support the bladder and stop urination. It's essential to find positions that minimize blood flow to the penis, such as lying down or reducing stimulation. By focusing on breathing deeply and evenly, you can activate the parasympathetic nervous system, which calms the body and aids in urination. Practice and patience are key to mastering this skill. You can also seek guidance from a urologist or pelvic floor specialist who can offer personalized advice and techniques based on your specific situation. Erectile dysfunction can result from various factors, including physical, psychological, or lifestyle-related issues. Now, let's explore more about Peyronie's disease. So Peyronie's disease is a rare penile disease characterized by plaque buildup in the penis, leading to a curved or angulated erection. The diagnosis of Peyronie's disease involves a physical examination and tests to assess the extent of the condition. All right? So let's discuss what happens when you have an erection. But what about premature ejaculation? Premature ejaculation is a common issue affecting many men, and it is understandable that you might be seeking guidance on this matter. One approach is the stop and go method, also known as the start and stop method. And now let's talk about our final topic, penile girth. Factors influencing penile girth include genetics, age, and overall health. That's all for today. Please like and subscribe. See you next time.